HIV/AIDS is the greatest humanitarian crisis in the history of the world. AIDS has killed more people than all the famines, floods, natural disasters, and wars in history, and there is no end in sight. Nowhere are the effects of this devastating disease more evident than in the small African nation of Swaziland. Nestled between South Africa and Mozambique, Swaziland has the highest HIV/AIDS infection rate per capita than any place on Earth. More than 4 out of every 10 people are infected. 1 out of 5 children is an orphan. 15,000 households are headed by orphan children. Since 1990, life expectancy has dropped from 59 years to only 31. 7 out of every 10 women infected sell their bodies simply to provide for their children. The United Nations ranks Swaziland 4th in the world with food security issues. Starvation is threatening to outpace AIDS as the #1 killer. The entire nation is at risk. Bethany First Church of the Nazarene has established the Swaziland Partnership to prayerfully and strategically stem the tide of this crisis. A partnership has been established with Swaziland's Raleigh-Fitkin Memorial Hospital and their 17 rural clinics. We are now working to increase the capacity for healthcare through training, produce a standard treatment book to be used throughout the country, establish HIV/AIDS testing and care centers, provide clean sources of water by drilling new wells, renovate all 17 medical clinics, providing electricity and water, allow individuals from Bethany First Church to travel to Swaziland to provide hands-on assistance in caring for the dying and their families by providing food supplies, to work with local churches in showing the Jesus film, and to establish community gardens in partnership with orphan children. There is no cure for AIDS. The situation is desperate and easily overwhelming. We don't have all the answers, but we believe the church is uniquely positioned to play a key role in turning the tide against HIV/AIDS in Swaziland. We know we can't do everything, but we know we can do something. We must do something.